So I think as many of you in the room know, PARP inhibitors, oral drugs, are effective in BRCA1 and 2 associated cancers. And specifically in breast cancer, we have olaparib and talazoparib. For prostate cancer, olaparib, rucaparib. For pancreatic cancer, olaparib, and also rucaparib for the NCCN, and then ovarian cancer, olaparib, rucaparib, and niraparib. And particularly for ovarian cancer, the indications extend beyond the BRCA1 and 2 population. But this is just to give you an example of sort of how we got started and where we are. And you will note that these tumor types are all what I kind of consider canonical tumors. These are the cancers in which mutations in these genes are associated with these cancer types. We're going to talk a little bit later, but there can be mutations in BRCA1 and 2 in cancers that are not specifically these canonical tumor types. And sort of what does that mean? And can we target them therapeutically will be part of my talk as well. But just for background, these are 2 examples of studies that we've done. On your left is the Olympiad trial. This looked at olaparib compared to chemotherapy for germline BRCA1 and 2 associated metastatic breast cancer, demonstrating an improvement in progressive-free survival. There was also a doubling of the response rate, and this led to an FDA approval for olaparib in this indication. It was followed by work by Jennifer Litton and others looking at talazoparib with almost an identical curve. And on the right is a study done with my colleague Kim Rice at Penn, looking at rucaparib for BRCA1 and 2 and PALB2 associated pancreatic cancer. Everything below the line is a response. Below the dotted line is sort of a documented, if you will, response demonstrating activity. And so these were very exciting studies, very, very impressive data also in ovarian and prostate cancer, which I'm not showing you here. But the next question was, can you take it earlier? So even though there is this improvement in progression-free survival, you can see that we're not curing most people, although I do have some exceptional responders, including someone who's been on olaparib for 14 years now, but they're rare. And so what we need to do is try to take it into the earlier setting and see what we can do. So here's